Detect breast cancer early. Watch for these 6 signs and symptoms. Breast cancer is one of the primary causes of cancer-related deaths among women globally, but early detection plays an integral role in improving chances of successful treatment and long-term survival. By being aware of signs and symptoms associated with breast cancer, individuals can take proactive steps and seek medical assistance promptly. This article highlights 6 vital indicators of breast cancer early detection that could save lives. Lumps or thickening in breast tissue may be one of the earliest telltale signs of breast cancer, although not every lump indicates cancerous growth. Therefore, it's vital that any new or unusual lumps be evaluated by a healthcare provider as soon as they appear. Breast self-examination is an easy, non-invasive way for individuals to familiarize themselves with the normal look and feel of breasts, including changes or abnormalities like lumps that arise with time. When doing an examination on themselves, they should use pads or their fingers carefully touch all parts of the breast, including its surrounding areas, including armpits. Should something unusual appear, such as lumps or thickening, it's essential that medical assistance be sought immediately. Healthcare professionals play a pivotal role in early detection of breast cancer. At routine checkups or mammographies, healthcare providers conduct comprehensive examinations that include palpating for any abnormalities. Should any lump or thickening be detected during one of these screenings, additional diagnostic testing such as imaging, mammography, ultrasound, as well as biopsy procedures may be recommended to ascertain its nature. Keep in mind that not all breast lumps are cancerous. Most non-cancerous, benign lumps have multiple causes including hormone fluctuations, cysts, fibroadenomas, or infections, making early detection and medical evaluation the key factor to distinguishing between benign and malignant lumps. Changes in breast size or shape should always be treated seriously as possible indicators of cancer. Even minor adjustments could indicate breast disease, requiring medical advice if necessary. Pay special attention if any sudden, unexplained changes arise that warrant more investigation. Seeking professional guidance as soon as possible should further investigation become necessary. One of the more visible changes may include breast swelling. If one breast appears larger than another, there's been an unexpected rise in size without apparent cause, it's wise to consult a healthcare professional immediately. Swelling may be caused by fluid accumulation or inflammation, but it's important in ruling out breast cancer as a possible cause. Be mindful of changes that include dimpled or puckered breast skin. If it takes on an orange peel-like appearance with visible indentations or ridges such as visible indentations or ridges, this could indicate cancerous growth beneath the surface, causing ligaments and skin to pull as the tumors pull on them, forcing abnormal breast shape change due to tightened ligaments, affecting ligaments that support breast. At times, an indentation or flattening of the breast may become apparent when comparing one breast against another or by noting a change in the breast itself. Any unexplained alteration of breast shape should be evaluated by a healthcare professional as soon as possible, and symptoms associated with such changes should also be taken seriously. Note that these changes, while sometimes associated with breast cancer, could also have benign causes such as hormonal fluctuations, injuries, or infections that cause temporary breast swelling or shape changes. Still, it's better to err on the side of caution and get any unexplained changes checked out by a healthcare provider as soon as possible. Nipple abnormalities may serve as vital early detection and treatment indications of breast cancer and should never be ignored. Therefore, closely monitoring any changes or abnormalities on your nipples for changes and seek medical help eventually is key in early diagnosis and successful management of any issues that arise. One significant change to watch out for is nipple inversion, wherein the nipple retracts or turns inward instead of protruding outward. While some individuals naturally have inverted nipples, any sudden or recent instances should be evaluated by a healthcare professional as soon as possible. In particular, breast cancer tumors can often cause this challenge due to their growth causing inverted nipples to retract inward due to tumor growth. Nipple discharge can be another telltale symptom of breast cancer. While women commonly experience clear or milky discharge during pregnancy or breastfeeding, bloody or clear discharge experienced outside of these circumstances should be investigated by a healthcare provider to check for benign conditions or potentially breast cancer. Note any noticeable changes in the appearance of the nipple and areola, such as reddening, scaling, or crusting around it accompanied by itchiness or pain. While other skin conditions could possibly produce similar symptoms, it's essential that these be evaluated by healthcare providers to rule out breast cancer as soon as possible. As is important to keep in your mind, nipple abnormalities don't always signal breast cancer. In many instances, they could simply be caused by benign conditions like infections or hormonal shifts. It is still recommended to seek medical advice should any changes appear on your nipples, since early detection increases chances of successful treatment and is essential. Breast pain or discomfort is a frequent experience among many women that should not always indicate breast cancer. If persistent and unexplained pain arises and cannot be explained away by other means, such as physical conditions like obesity or menopause, seek medical advice immediately. Ongoing discomfort in one or both breasts could signal cancerous tissue growth that requires further evaluation and diagnosis. Breast pain may have various causes unrelated to cancer. Hormonal changes during menstrual cycles, pregnancy, and menopause may contribute to breast tenderness or discomfort. Additionally, injuries, muscle strain, or benign breast conditions such as fibrocystic changes or mastitis could also transfer into pain in breast tissues. However, persistent breast pain that does not have any apparent source or follow an apparent pattern should be evaluated by healthcare providers. This is especially crucial if the pain affects only one breast. Any changes to intensity or frequency should also be reported to healthcare professionals. As part of your evaluation, healthcare providers will consider many factors, including your medical history and any symptomological accompaniment, in order to ascertain what caused breast pain in you. They may perform physical exams or order diagnostic tests such as mammography or ultrasound before considering additional investigations as required. If breast cancer is suspected, additional tests such as biopsy procedures may be recommended to confirm its diagnosis and improve treatment options and outcomes. Early detection provides greater possibilities and better results. Skin changes over the breast area can be telltale signs of breast cancer and should be taken seriously. Any noticeable alterations to its texture or appearance must be reported quickly to a healthcare provider as soon as they occur. One skin change to keep an eye out for is persistent redness in or near a breast area or localized region, often with warmth or tenderness present. While redness could be caused by various sources such as infection or inflammation, it should always be evaluated by healthcare providers in order to rule out potential breast cancer risk. Thickening of breast skin should also be noted. If an area becomes thicker than surrounding tissue or feels pitted, resembles dimples, that could be an early indicator of breast cancer cells infiltrating and pulling at nearby tissue, causing changes. Small indentations or retractions of skin may also indicate breast cancer, with subtle or more obvious grooves or folds appearing under your skin. If any unexplained indentations arise, it is critical that they seek medical attention as quickly as possible for further assessment and evaluation. Skin changes have many causes and should never be seen as definitive indicators of breast cancer. Skin infections, dermatitis, or other benign conditions that could also contribute to redness, thickening, or indentation on your skin. It is best to err on the side of caution by consulting your healthcare provider regarding any unexplained changes you notice on your body. Swollen lymph nodes in the underarm or collarbone area may be an early indicator of breast cancer. Although enlarged lymph nodes could also result from infections or other non-cancerous causes, it is crucial that they are evaluated by healthcare providers so as to eliminate any possibility of cancer development. Lymph nodes play an essential part of our immune system by filtering and trapping harmful materials such as bacteria, viruses, and cancer cells that travel through lymphatic vessels. When breast cancer cells spread via lymphatic pathways, they may connect in nearby lymph nodes, causing them to enlarge or even become tender over time. If you detect swollen lymph nodes under your arm or near your collarbone, it is vitally important that they be assessed by healthcare professionals. They will perform a complete examination, taking note of size, texture, tenderness, and any additional symptoms or changes you have noticed. Further diagnostic studies such as ultrasound or positron emission tomography (PET) scan imaging studies may be recommended to ascertain the extent of lymph node involvement and potentially confirm cancer cells by performing biopsies on affected lymph nodes. Keep in mind that lymph nodes swollen by other conditions like infections in the breast or nearby should always be evaluated immediately in order to provide accurate diagnosis and treatment. Any unexplained or persistent swelling must also be promptly evaluated in order to provide timely assistance in diagnosis and therapy.